Okay, thank you, and good morning to everybody. Today I'll be describing you an outbreak, or a severe outbreak of Anaplasma phagocytophilum, which happened in a goat herd in the province of Trento last year in 2015. And the province of Trento is a little region in the northeastern part of Italy, in the heart of the Alps. A short introduction to the problem. Anaplasma phagocytophilum, AP for short, is a small intracellular bacterium which infects white blood cells, in particular granulocytes and monocytes. It is transmitted by ticks of the genus Ixodes, and in European countries mainly by Ixodes ricinus. From the image on your right, you can see the life cycle of AP, and it involves wild mammals, wild ungulates, for example, roe deer in particular, or red deer, and rodents. It causes human granulocytic anaplasmosis, which it is a zoonosis, pay attention, and as well as tick-borne fever in ruminants. Equine granulocytic anaplasmosis, and it could affect also other species like cats or dogs. It is widespread over the world, in Asia, Europe, and in the USA. It is considered one of the most important tick-borne diseases in the USA. Not sufficient data are available on goats and on severe clinical outbreaks in goats. That's why it elicits our attention, our interest. Oh, sorry. Okay, our story starts in June 2015, when a practitioner brought to our lab, I am a vet of the lab, and 5 blood samples taken from 5 lactating goats, which were at pasture, reporting a high temperature, a febrile syndrome, high temperature, more than 40 degrees, apathy, poor appetite, and sudden drop in milk production associated with an increase of the somatic cell count, and a particular symptom, hyperemic stains on the other skins. The 5 blood samples were taken from 2 recovered goats and 3 symptomatic goats at that moment of the outbreak. We, together with the vet, started to collect some data in order to understand better the focus, the outbreak, because the vet didn't know what was happening within the herd at that moment. It is a large-sized goat herd, large size for our region, which is characterized by small, familiar, managed farms, herds. It is at about 1,100 meters above sea level with 200 lactating goats. The farmer breeds Saanen and Camosciate delle Alpi. I don't know the name in English. It is a characteristic breed of our region, and crossbred goats. Only lactating goats were led to the pasture. It is an important information for us, because only lactating goats manifest the symptoms. And the vet reported that the farmer picked off about 5, 6, 7 ticks every day in these animals, per goat. Could it be a tick-borne disease? This is our question. And what can I do with these 5 blood samples? This is an important question. And we decided to test these 5 blood samples for the presence of hemoparasites, AP, Babesia, and Theileria by PCR assays. And we tested also the serum for AP antibodies using an immunofluorescence assay with a cutoff titer of 1 to 80. It is used for IgG and AGM2. In the meantime, in the 3 weeks following the outbreak, the first sampling, the story goes on. And approximately 45% of animals at pasture became ill, 1, 2, 3. But all the animals in the farm were completely healthy, were well. and there were young animals. These are our results from the first diagnosis from these 5 blood samples we are taking. Of 5 animals tested, all animals resulted positive for AP in the blood, and only 1 animal resulted positive for antibodies with a low titer, with a low titer, 1 of 280. We, together with the farmer and with together with the farm vet, decided to follow up this outbreak and to follow 22 adult goats, which were randomly selected among animals which were led to pasture during the summer period in 2015, naturally. And we monitor symptoms of these animals, and we perform molecular and serological investigations on blood samples. And these are our results. The blood samples were taken in July and in September 2015. And in July, we see that eight animals resulted positive for AP in the blood by PCR assay, and 15 animals resulted positive for AP antibodies in the sera, with titer ranging from 1 to 160, for example, the animal number 6, to 1 to 2,560, for example, 9 or 10. And in September, the scenario completely changed because only 3 animals of 22 animals tested resulted positive for AP in the blood, and only 9 animals resulted positive for AP antibodies in the blood. So we can see a rapid decrease of antibody titers of the animal except 3 animals. For example, I don't remember this one or this one, and a decrease of the number of animals resulted positive for AP. This wasn't a very happy information. It's very funny information for the farmer. We decided to follow up the outbreak, taking into account also the pasture, and we went to pasture in September 2015, collecting question ticks from pasture using a standard blanket dragging, as you can see from the picture. And all the ticks collecting were identified as Ixodes ricinus, and they were tested in pool, in the lab, and 2 pools of nymphs, only nymphs, not larvae, resulted positive of 14 tested, resulted positive for AP, with a minimal infection rate of 2.7. We decided to involve also the Hunters Association, which were asked to collect roadkill spleens from animals belonging to the neighbor reserves, and only 1 samples was taken and was collected, but it resulted positive for AP. We have seen that there is an identity of 100% using our PCR assays and our sequencing among the isolates taken from question ticks, taken from goats, and taken from the spleens of these animals. I'm coming to the end of my presentation, and AP had important economic losses for our farmer and for our farm. And we had an increase of the somatic cell count, and milk production went down, deaths went up, vet costs went up. And from the table, you can see 2 graphs. The first one show you the monthly milk production in 2015, indicated as the continuous line, and 2014, indicated by the dotted lines. And you can, the animals were the same, but the number of animals into the herd were the same, naturally. And we see a decrease on the milk production in 2015, the year of our outbreak. In the second graph, you can see the somatic cell count, the average number of somatic cell count, and it was a problem because in 2015 we had an increase of the somatic cell counts, and this hurt. Our conclusions are that, as far as we know, this is the first case of a severe outbreak of Anaplasma phagocytophilum in a goat herd in Italy. But it caused important economic losses for the farmer. It is a zoonosis. We have to keep in mind this important factor, and the high numbers of symptomatic animals in our herd can imply an important infection in ticks. We don't know if our strain of AP is more pathogenic, more virulent than the others. We are studying this because further investigation these goat herd are ongoing in order to better understand the antibodies dynamics and the infection dynamics and over time. And our thanks go to goats, which we have run after. Danilo and Sons, the farmer, you can look at in the picture, sorry. And Dennis Vinante for goats production data, and all personnel of the lab for the analysis. Thank you very much for your attention.
Thank you very much, Deborah. It was a lovely case report. I'm sure they'll be interested in this because we have a lot of interest in this country, I know. So, questions, please. Please introduce yourself briefly.
Laurent Deleuze from Belgium. Did you observe abortions?
No, we didn't observe abortion. I know that AP can cause abortion because it is studied in sheep, because most of the studies are in sheep. But we didn't see any abortion, probably because the period in which the AP was introduced in our farm, in our herd, was in a period of only lactating goats which weren't pregnant at that moment. I think, because kids are born in January in our region normally. Yes, but it is an important question, an interesting question.
Just at the back there.
Yeah.
Hello, Michael. Interesting presentation. Michael Morris from Trinidad and Tobago. Was it seen on simple blood smear?
Yes, we did blood smears. I didn't show the results in this presentation, and in July, in the samples taken in July, we saw the characteristic inclusion into granulocytes, but only in July. In September, no.
And did you see it in the bloods? Did you see it in the blood smear of all the animals that proved positive on PCR?
Yes, in the most of the animals positive in PCR. Yes.
Thank you.
Yes. If animal wasn't positive in PCR, we didn't see any inclusions.
Time for one more question.
Mary Ballaro from Brazil. Did you find some clinical finds from that positive animals in PCR that you showed to us in different moments?
Yeah, the only symptoms, the characteristic symptoms, was this febrile syndrome. We didn't see any differences between positive animals and negative animals, because also negative animals by PCR and for antibodies could have symptoms. Unfortunately, it's not as particular. But among animals which were led to pasture during the summer period, about 10 animals, as the farmer reported, present diarrhea, and 4 of them died. We didn't see, I do the necropsy, but he didn't see these animals. Yeah.
Okay, thank you very much again, Deborah. That was a very interesting presentation.
Thank you. Thank you.
Thank you.